I'm Dr. Adriana Potter, and on Benefit Yourself series video today, we're going to talk about poo. And in this video, you're going to find what it is, the healthy bowel style that you should be aiming for, the common causes of constipation, as well how to treat them. In terms of normal bowel movement, there is a huge range about what it is considered to be normal. People can have bowel movement as little as 3 times in a week and as much as 3 times in a day. If you look back and how it used to be when you were a baby, you have a bowel movement pretty much every single bottle. And as we grow older and we start to conform to how we behave outside of the house and go to daycares and school, that disrupts a little bit that bowel pattern, and not everybody feel comfortable pooping in a public environment, in a public bathroom, and then end up kind of deferring the urge to defecate and inhibiting that over and over time, and end up having a constipation issue. But constipation is not considered just how frequent or infrequent you actually have a bowel movement. Constipation has to do more with how much straining you have when you have a bowel movement. If you strain a lot and you hold your breath and you turn in red and have hemorrhoids, you have constipation. When it comes to straining multiple times through those bowels, you're gonna have more complications about the pelvic area, injury to the muscles, hemorrhoids, rectal bleeding, as well as prolapse. And that's not the only things that can happen, there's more stuff to it, but those are the things that more commonly happen when you're straining every single bowel movement, okay? What we're looking for is to have the consistency and the shape of a ripe banana. Yeah, you're never gonna eat the same. When you eat a banana, you're gonna be thinking about poo. But that's the shape that we're looking for. And the Bristol scale talks about different types. So if you are type 1, you're very constipated, you have pellets when you're pooping, and you're probably straining, and it's hurting when you're passing a bowel. There's just a couple of reasons why you're gonna be on the type 1 of that Bristol scale, and we're aiming for that type 4 of the Bristol poop scale, which is the healthy consistency of a bowel. And if you're going towards the opposite end of that Bristol, it is more of the diarrhea, more commonly associated with IBS issues, as well as other food intolerance issues. So if you're in either extreme of that Bristol scale, you are not on a good zone for your healthy bowel, and you want to be aiming to move towards the center of the scale on a type 4, easy to pass, not straining, and ideally happen at least once a day. All right, so let's talk about some of the common causes of the constipation. The most common cause of constipation has to do with the multi-pharmacology that our society has engaged lately. A lot of the heavy medications for pain, as well medications for reflux and GERD, and as well other gastric issues, it will ultimately cause constipation. So medications is one of the causes of constipation, and I will highly urge you to look into the side effects of your current medication. And I'm not going to ask you to change those medications. You probably need to be on them, but be aware that the reason you might be having that constipation is because it's a side effect of that medication. The second thing that causes constipation is a poor diet. You're either having too much carbohydrates, too much sugar, processed sugar, or fat, saturated fat, and those can interfere with the bulky formation of your bowels and get too much solid and hard. And so diet is also very important, and we're going to talk about that in the future videos. Lack of fiber, yet I also think related to the diet. A lot of people don't eat a good amount of fiber, and you're going to hear about in a little bit how much fiber should you be eating on a regular basis. Water intake is another thing that is very important. Many people don't like drinking water, and elderly in general avoid avoid drinking water because they're having bladder issues. And if that's the case, you should be watching the video Mind Over Bladder to help you with those bladder issues. But you shouldn't be avoiding taking water because of your bladder, because it will create bowel issues. But dehydration, if you think about, if you are dehydrated, it's not just your muscles, but also your gut. So your poop's going to be hard and hard to pass. If you don't change the hydration, no matter what you do, you're not going to have enough water, because your body will try to take as much as it needs, and it will take it from your gut, from your poo, so your poo will be left off very, very dry. Poorly chewing your food. First enzyme we release in our digestion system is amylase, which is produced in your saliva. So if you're eating too fast meals and not properly chewing, you're not releasing enough of the amylase into your mouth to help you into the gastric juices that will be released further down into your gut. So chewing your food properly, it can help you in improving your bowels, and also improves the peristalsis, which can affect the frequency of your bowel. Stress is another common cause of constipation. When you're very, very stressed, you increase cortisol levels, which decrease your metabolism. And if your metabolism is slower, so it is your gut. So you're gonna have less frequent bowel. And as the poo stays longer in your body, more water is taken out of it, and you end up having more dehydrated bulk into your colon and rectum, which then it will be hard to pass at the time of defecation. Hormones will also affect your bowel, and as you know, with many of the pregnant ladies that experiences constipation early in their trimester, has nothing to do with the baby because it's too small. It has to do with the changes in the hormones. So hormones will affect your bowel. Another thing that is commonly misused is laxative, and the problem with laxative is that it bypasses your natural pattern of your bowel. And when you experience a constipation or a painful bowel, a lot of people resort to using laxatives as their method of having a bowel movement, and that will inhibit your normal gastric system from working properly, and it will slow down a little bit your peristalsis, because it will pass it too fast, and it will eliminate a lot of the healthy bacteria in your guts, which will affect your digestion and absorption. So be aware that prolonged use of laxatives can create more constipation, and you become more reliant in using the laxatives to help you have a bowel, because your body no longer able to produce the normal secretions or normal peristalsis, a normal gastric pattern to do a proper elimination naturally. So straining your muscles, very often when you're straining, you're trying to push the poo out, and it will create more issues with the prolapse. And also the pelvic floor may instead be relaxing to pass that bowel. It will be kind of tightening up on you, and instead being able to open to allow the passage of the stool to go out in the rectal canal, it will pretty much shut down on its own, and you won't be able to have an easy defecation.
Lack of exercise is also one of the common causes of constipation, because it slows your metabolism, and as your metabolism is slowed down, you're also going to have less infrequent bowels. And again, if you are having less frequent bowels, your poo staying longer inside, and it's drying out and having to strain for a bowel. Another big thing is that changing routines. When people change their routine, they have issues with constipation, so sticking to the same routine and making adjustments on that, it will help you to maintain a good bowel frequency and consistency. As you can see, there is a lot of things that we brushed off during this video about the cause of the constipation. This is not all inclusive. There's a lot of other things that will cause constipation issues, and I try to just cover up the most common ones.
So let's jump in on the common things that are used for treating constipation. When patients come to the pelvic floor rehab in my clinic, I go over this list and I customize to their need. Not everything that I'm going to mention here today, it will work for everybody, and a customization, knowing what to change and when to change, usually comes during the conversation with the pelvic floor physical therapist. So this is just to create awareness that this is what we do and those are the things we address, and will help you to facilitate and introduce those treatments to our patients to help them to restore a better frequency for bowel, as well as consistency of their stool and the proper mechanics of defecation. Exercise is the number one. As you become sedentary and your metabolism slows down, so does the rest of your body, including your peristalsis and your gastric reflexes. So starting an exercise program can help you to improve your bowel frequency. Stretching. Stretching is very good for you. Any sort of twisting of your trunks or your spine and relaxing, and it will help you to massage your internal organs, which can help and facilitate the mechanical pressure into your abdominal cavity and facilitate the peristalsis and the passage of your bowels. If the problem is straining because the poo is too hard, we want to change the consistency. And when it comes to change the consistency, three main things come in mind to me. One is the water intake. Is that adequate to your body? Are you having enough water in your diet that will give you a proper hydration, not only for your muscles, but also for your stool? We know the recommended is about 80 ounces of water per day. For somebody who's constipated, I would probably go a little bit higher. When you talk about increasing the water intake, you have to do it slowly so your bladder can adjust to that. The second thing, it is fiber. You want to make sure you have the good amount of fiber. It takes for a person about 25 to 35 grams of fiber, soluble and insoluble fibers for you in your diet, for you to have a production of a good bulk with good water intake. If you only increase your fiber and you do not increase your water, you're gonna end up with more difficult bowels and harder stool to pass, and that you're not gonna be successful with what you're looking for. So you increase your fiber gradually. I usually tell my patients, eat about 4 to 5 tablespoons of oatmeal every day. Start with something simple like that, and then go into a couple other things that you can introduce in their regular diet. When it comes to straining, we're talking about relaxing the pelvic floor, and stretches can help to relax the pelvic floor, but sometimes you might need a pelvic physical therapist to assess your ability to relax those muscles properly and bear down properly for defecation. If you're doing the wrong way, you will create other issues. So you want to make sure that you're doing the right way, and doing with a pelvic floor physical therapist is ideal. But if you are doing at home and just trying to promote a general relaxation, nice and slow breathing will help you to relax your whole body, including your pelvic floor muscles. The squatty pot is another tool commonly used to help with defecation, because it puts your hips into that deep flexion, which relaxes your pelvic floor a little bit more. So we recommend the squatty pot quite often to our patients. I personally recommend the pelvic dance, which is, I tell them, pull your flush out to the sides and rock in the toilet as you're breathing out, and you rock it side to side. You may find out as you're doing that, you gently passing the stool down. So relaxation in the toilet as well as outside of the toilet can help you to regulate your nervous system, which will help with relaxation of your muscles, your mind, and improve the frequency and passage of stool. Warm fluids is something that can help to trigger more peristalsis. We recommend using a little bit of warm tea or coffee. Some people, coffee can help, other people, coffee makes it worse. So play around with just drinking tea if you're not sure. If your coffee is not your practice in the morning, just drink some warm tea, or some people even do warm water in the morning. So that's one thing to do. Make sure to establish a bowel routine. Bowel likes routine, and when you break it, it won't happen. You notice that when you change your routine and you're traveling around, you may notice that your bowel doesn't happen. It's not going to work it because you broke your routine. And people tell me all the time, yeah, when I travel, I'm constipated, and it doesn't work until I get back home. Bowel likes routine, so establish a routine and try to have that about the same time of the day. Usually happens about half an hour after your first meal in the morning. So establish a routine that you can have an easy start in the morning. I have patients that purposely wake up earlier to start their breakfast and sit in a nice relaxing area that allow them to have a bowel movement within that half an hour. If you have not done that, give it a try. You may find out that it's an easy trick like that will start creating a little bit more of that bowel routine and improving your frequency of your bowel. One thing at a time for consistently for 3 to 5 days, and you may find out that will help you to get a little bit more of that passage of stool. And also, if you're having right now, if you really back up and your poop is really hard, difficult to pass, you really feel like you need to strain, it hurts you, have active hemorrhoids, using a stool softener can be quite helpful. I do like the propylene glycol medications, actually supplements. Those are the Miralax, and they have Clearlax, and they are not laxatives. They are helping you to drive water into the stool. They are stool softeners. They're two different things. Stool softeners are not laxatives. Stool softeners just drive more water to the poo. So you need to make sure you have good, adequate water. Otherwise, you dehydrate your body when you're doing those stool softeners. So go ahead and start with the softeners. I like the powder version personally because you can find out what it is the right amount for you, and varies from person to person. But do it consistently, the same amount to 3 to 5 days. Once your stool gets too soft and messy to wipe, you know that is helping too much, you need to back off from it, right? So decrease the amount a little bit of those stool helpers, stool softeners to help you pass the stool. Some supplements can be quite helpful to do a natural stool softening, like magnesium and vitamin C. Those are natural stool softeners, and it will make your stool a little bit softer and easy to pass. Magnesium is my favorite one. Many of my patients take it at nighttime for muscle relaxation, and that will help with the bowel as well. If you absolutely back up and then you're trying to do those things, but the poo is not coming out and you feel like it's right there, suppositories can be quite helpful. I prefer the glycerin suppositories versus the laxative suppositories, because the laxative, again, they bypass your natural signals for you to defecate. The glycerin, it just moisturizes the rectal canal and makes it easy to slide it out. Ultimately, we're looking for that easy to pass, the consistency in the shape of a ripe banana. And if you're not getting that, or you are getting that, but it's too hard to pass it because it's too dry, the glycerin will help you, okay? Hopefully you found this general information of all the things that can be done for bowel changes, and you kind of start picking one at a time, introducing them in your daily life to help you normalize. I cannot state enough times that the best thing is to work with a pelvic floor physical therapist that will customize your needs and monitor how your body is responding to the changes, to the modification of your habits, to promote that proper bowel consistency and frequency, as well proper defecation. Thanks for watching the Let's Talk About Poo video on Benefit Yourself series. I'm Dr. Adriana Potter. Don't forget to subscribe to the channel Physical Health by Dr. Potter, and press the bell button so you can get more updates on the future videos.